celebrating International Women's Day, and it wouldn't be a real discussion if we weren't talking about our health.
Yeah.
We dealt with the nutrition in the kitchen just a few minutes ago. Now we're going to talk about some key health issues. And to do that, we're pleased to welcome to the studio Dr. Sony Singh. He is the Vice-Chair of Gynecology at the Ottawa Hospital.
So good to have you here.
Yeah, it's great to be here on this day.
You didn't bring your runners, though, today.
No, I didn't. No, I've got them in the car, though,
Do
if
you?
you want to go after. Yeah.
Because you've got a big campaign that
Yeah.
you've got underway again this year. You've raised a lot of money for the Ottawa Hospital and women's health issues in particular. You're running for a reason this year.
Yeah. So I've been doing it for a while, and the reason that I run and the reason that I do what I do is for women's health. And so this is a great day to talk about it, International Women's Day. And over the last few years, we've raised over $40,000 with this campaign through the Ottawa Hospital Foundation and the Ottawa Hospital.
That's awesome.
That's awesome.
Now, as far as women's health is concerned, one of those major surgeries that we hear about over the years has been hysterectomies. It's a surgery that women fear. It changes them, obviously. But it's a major surgery.
Yeah.
And you've released a study that shows that there are less invasive ways of having that operation now.
Yeah.
Today, in fact.
Yeah, that's right.
Yeah.
Yeah, so the release came out today. Ottawa is a really special place for many different reasons. And the Ottawa Hospital, about 8 years ago, invested in minimally invasive surgical options, and that included those for women. So traditionally, when a woman needs a hysterectomy, it's a tough decision. We've made it a little bit easier because the recovery can be easier.
Okay.
So a traditional incision would have been a big cut on the abdomen and a 3 to 4 day stay in hospital with the related complications, pain, infection. But imagine having your problem or issue dealt with through a small incision about 1 centimeter in size, or no incision, and we can get you home the same day.
Wow.
That's what we've been able to do at the Ottawa Hospital. So in 2005, before we started doing this, 40% of hysterectomies were done minimally invasively. So it means majority of women had the big cut.
Right.
Today, almost 75% are done through a less invasive route.
Isn't that amazing?
Yep.
That is so wonderful. I wanted to ask you, Dr. Singh, when we visit our doctors, you know, as women, we are pretty proactive
Yeah, I
when it
think
comes
we
to our
are.
health.
Yeah.
But there are also some things that maybe we don't think of asking. I wanted to ask you specifically, what are some questions that we do need to ask our gynecologists and our family doctors when we visit them that we really need to focus on?
Instead of thinking, oh, I'm supposed to feel this way, say,
Right.
you know, when it's that time of the month. Or-
Right.
Exactly. So first of all, preventative care is the key issue. So making sure you stay healthy, and you're talking about that today, is fantastic. Now beyond that, what I tell our patients and what I hope to impart upon my daughter is that when you're not feeling well, you have to advocate for yourself.
Sure.
So a painful, heavy period which doesn't allow you to go to work, you can't function, you can't concentrate, is not normal. It's one of the biggest challenges I see, because when I see a patient finally who is accessing treatment, it's been years of suffering because they've been busy. They've been busy with work, as you
Sure.
said before, been busy taking care of family, doing whatever they want to do, and they put their care second. So on today, on International Women's Day, it's important to remind women to make themselves the priority and get them the care in a timely fashion.
And sometimes unless we do talk about it, like what you were saying, we don't know that. We just think, you know, everybody has a heavy period.
Yeah.
Everyone has it rough, you know, for a few days or a week during the month, and that's just the norm. Until we do talk about it, not only then will we realize that no, that isn't the norm.
Yeah.
There are things that we can do and help we can get.
Exactly.
Yeah.
So being anemic, which means you have a low blood count because of your period, is not normal. It means you can't concentrate, your memory's off, you can't do the things you want to do. You can't work out or exercise and be the person you want to be. That's not normal. To experience so much pain in a young woman who can't go to school every month because of periods, you know, that's not normal either.
Right.
And so I think what we have to do is, first of all, be open to talk about this. I'm so happy that we're talking about periods and pelvic pain.
Openly.
Because we
Yeah.
want to talk about it. I want my sons to grow up knowing
Right.
just as much as my daughter about women's health issues, so that we can advocate for each other and help the women out there.
So is there something for anybody who's listening saying, yeah, I go through that. Is there something really wrong with them? Or you know, what is leading to this uncomfortable pain that they're seeing once a month or
So
experiencing?
so there are many different conditions which can result in that. And the most important thing is to first start the dialogue, have a good history, physical examination, and sometimes imaging like an ultrasound will help.
Okay.
So some of the conditions that cause this are uterine fibroids, which are benign growths of uterine muscle that can grow slowly in the uterus, and they cause heavy menstrual bleeding.
Okay.
And the other condition we see a lot is endometriosis, a condition which causes pelvic pain. And those are the questions and things that we need to look into when I see a woman who's really suffering from pain. So bottom line is, yeah, it's not normal, and there are conditions that we can help with, but we just need to know about them.
That's wonderful. You mentioned uterine fibroids.
Yeah.
Can you talk a little bit about that? Because I know it's something that's quite common with a lot of women. So when do you need to be concerned?
Yeah.
If you do have fibroids?
I'm glad you brought up uterine fibroids. It's crazy that actually the majority of women in their lifetime will have uterine fibroids.
Right.
Most women won't know about it because they're not all symptomatic.
Right.
But depending on the ethnic group as well, for example, women of African origin, up to 80% of women of African origin will have uterine fibroids, and half will be symptomatic.
Oh, wow.
And that is your heavy menstrual bleeding, difficulties getting pregnant. And today, more than ever before, we actually have more treatments available, and it doesn't mean a hysterectomy. So I know we spoke about hysterectomy as one option. That's our last resort.
Right.
We have so many less invasive alternatives that we can look into. So I think that talking about it and awareness about these issues is so important. But look how common it is. It's crazy.
Yeah.
I had no
It's
idea
crazy.
it was as common as it is.
Thanks for being here today.
It's my pleasure.
Good luck with the run. I hope you raise a lot more money this year for
Great.
Run for a Reason and helping support women's health here in Ottawa. It's a great thing that you're doing. Thank you.
Thank you
you
very
so
much.
much.
Bye.
Coming up next on Daytime, we're going to continue our conversation with International Women's Day, and we'll be joined next by Catherine Clark.